जी मैडम, ये रिकॉर्ड भी हो रही है जी? ठीक है।
जी जी, ये रिकॉर्ड बिल्कुल स्टार्ट हो चुकी है। ठीक है।
ठीक
अस्सलाम
है मैडम।
वालेकुम everyone. My name is Dr. Aisha Hanif, and I am here to discuss about how to proceed with AKP preparation. Okay. As our batch October especially have done with FOP and TAS, and now they are planning to go for AKP. So why I prepared this lecture, so that I can provide a basic information or basic pathway to proceed with the next preparation. Okay. So let's start. What about AKP? So how AKP is different from the FOP and the TAS? We will cover this point. But the important thing is that the AKP is the test which basically, needs the information regarding your clinical practices. Okay. So if you are especially in the training, or if you are working in the pediatric environment, or in pediatric under a pediatrics, so it will going to be help you a lot. And what type of questions you will came across in AKP? So you have a variety of questions in AKP. You will have just like a TOACS like exam. Okay. So you have a picture. Maybe the picture is a dermatology picture is there, along with the clinical vignette is mentioned over there. Or you may have radiology pictures, CT scan, MRI, X-ray, or maybe you have some investigations. Maybe they give you some very basic investigation like CBC and all that. So how you going to interpret all this? So these type of questions will be a part of your AKP. So along with the investigation and type question, they also ask you about the management as well. So in FOP, basically they were concentrating upon the diagnosis, or they ask about the basic initial diagnostic test. But in AKP, they tell you they ask you how to interpret different types of test, or different types of investigations. And then they ask about the management as well, how you going to proceed with it. Okay. So that is about the AKP. So AKP, like FOP and TAS, it is mentioned that
इसमें इसके इसके दो पार्ट होते हैं मैडम, या 100 के दो
इसके
होते
भी
हैं
दो
इसके?
पार्ट्स हैं। इसके भी दो पार्ट्स है, AKP1, AKP2। बट वो बोथ जो है ना सेम डे पे होंगे। तो टोटल आपका जो एग्जाम होगा, आई विल मेंशन इन माय कमिंग स्लाइड्स दैट द ड्यूरेशन ऑफ योर टोटल एग्जाम वुड बी अराउंड 5 आवर्स। ओके। यहाँ पे 2.5 आवर्स का पेपर है। In FOP
ठीक
and
है।
TAS, your duration was 2 hours for each paper, but for AKP, the duration is long. It's 2.5 hours, and it is against consistent of part A and part B, and you have to take this exam on the same day. उसमें कोई choice नहीं होती है कि part 1 पहले हो जाएगा या part B. Okay. So you have to take this exam as a whole. Okay.
ठीक है मैडम।
Okay. Next important thing, diet. So you can see you have 3 diets for this exam. You have January, May, and September. Okay. So like FOP and TAS, we also have 3 diets in a year for this exam as well. Then we talk about the date. So it is mentioned over here because, the many candidates are planning for this exam. So you can say the exam date is on 22nd January. That exam will be everywhere on the 22nd January, like FOP and TAS. And application date, if we can see in our Pakistan, it will open on Tuesday, 5th November. So kindly, note this date. Okay. So for Pakistan, the date is Tuesday, 5 November. Test center in the Nepal, India, Pakistan, Sri Lanka will going to be open on the 5th November. Okay. And you can also see that the online applications will going to be closed. Online open. So online application will open at 4th November, and it will going to be closed at Friday 8th. So we have 2 types of applications which are relevant to us. The first is the Pakistan application written center. This is for center. So please very, very clear that this Tuesday for Pakistan, this seat is for the center. And this online is different. This is on the computer based on your home. Okay. This is not the center based seat. Okay. The rules and regulations for online we have already discussed in our FOP and TAS introduction. So we do not need to, talk about again.
अच्छा मैडम, इसमें एक कंफ्यूजन है, 4 को ऑनलाइन की ओपन हो रही है और 5 को सेंटर की हो रही है।
हम्म
इसमें तो ये होगा, अगर हम ऑनलाइन स्किप कर दें कि सेंटर में मिल जाए और सेंटर में भी ना मिले, ऑनलाइन भी खत्म हो जाए तो।
हम्म इट्स लक, इट्स लक। ठीक है,
अच्छा।
ओके, इट्स लक।
ठीक है मैडम, ठीक है। मैंने तो अभी ऑनलाइन दे दिया एफओपी और टास्क, उसमें कोई इशू नहीं हुआ। तो रिस्क लेने के बजाय अगर मैं ऑनलाइन ही कर लूँ उसमें तो कोई इशू नहीं है, क्योंकि अभी मैंने रिसेंटली दिया, उसमें कोई इशू नहीं हुआ।
कोई इशू नहीं हुआ ना? सो ऑफ कोर्स अगर आप फॉप एंड टास्क के लिए इफ यू वर एलिजिबल फॉर द ऑनलाइन, उनका क्राइटेरिया, इफ यू आर फुलफिलिंग द क्राइटेरिया फॉर ऑनलाइन एग्जाम, then definitely you can go with AKP as well, very safely, without any hesitation. Go for it. Okay.
यस मैडम, रिस्क नहीं लेना चाहिए, क्योंकि मैं सेंटर का करूंगा, ऑनलाइन से भी हाथ धो बैठूंगा।
Okay, no problem. It's all up to you. Okay, so it's all up to you. So for 4th November for the online invigilation, and for 5th is the for Pakistan. And if someone plan for UAE and other centers, so accordingly it is written in this slide. Okay.
ठीक है।
Next, this slide is basically tell you about the fee structure. So FOP and TAS, you have a two separate papers for they were, you have a basically an option. Either you can give exams separately or as a combined. But for AKP, you do not have any option. You will have two papers, and you can see the fee structure. It is 895 pounds. This is the recent fees, okay? And this is for Pakistan, okay? And again, as you were asking me, is it AKP as also a two parts? Yes, it's separately. You have two papers, but these two papers will be on the same day. And the duration, I've clearly mentioned over here from the website that it is 2.5 hours, and total exam duration would be around 5 hours in total. Okay. So what type of questions you will have? So you can see over here that you again in the AKP, you will going to have exam of single best answers. Okay. So like FOP and TAS, you will know you do not have any EMQs. Directly you have single best answers, and in each paper you have 60 questions total. So for FOP and TAS, they give you 100 questions. Am I right, Dr. Ikram? 20 questions,
यस,
100 questions,
यस मैडम,
100
यस।
questions for FOB, 100 questions for TAS. But for this exam, 60 questions per paper, and you will have more time, 2.5 hours for 60 questions. Okay, so the time limit is there for this paper. More around 2 minutes, 2 to 2.5 minutes per question, you have a time. Okay, so you can, do it accordingly. So this is the 60 in each paper, you have total questions. Okay. So now you have a questions with different type. I told you some questions will be only scenario based. They just give a scenario.
डॉक्टर आयशा,
Yes.
इसमें ऐसे नहीं है कि 100 क्वेश्चन है उसमें से 60 सिंगल बेस्ट टाइप है और जो 40 है वो उन्होंने दूसरे टाइप है, एक्सटेंडिंग एक्सटेंडेड मैचिंग या फिर ट्रू फॉल्स टाइप है टोटल 100 ही दोनों पेपर में।
100 ही टोटल है। अच्छा, तो ये उन्होंने तो ये मेंशन नहीं किया हुआ है कि 120 आपके सिंगल बेस्ट आंसर्स है ना, तो आपके पिक्चर्स भी सिंगल बेस्ट आंसर्स ही हैं। जिसमें जो है ना आपके पास सिनेरियो होगा, एंड देन यू विल हैव अ पिक्चर, एंड देन यू विल हैव अ 5 ऑप्शंस, एंड यू हैव टू सिलेक्ट वन फ्रॉम इट।
नहीं, इसमें ऐसा है कि इसमें कुछ ऐसे इन्होंने सिनेरियो बेस्ड भी पिक्चर्स के साथ दिए हुए और कुछ आइसोलेटेड पिक्चर्स भी दिए हुए, कुछ रेडियोग्राफिकल वो भी दिए हुए हैं, लेकिन उन सब में ये है कि 60 सिंगल बेस्ट टाइप होंगे, सिंगल लाइक सिंगल बेस्ट आंसर आउट ऑफ 5 ना, तो क्या बोलते हैं, बेस्ट 5 वन बेस्ट 5, ठीक है। लेकिन जो बाकी 40 है ना, वो बाकी 40 भी हैं, अब वो EMQ की फॉर्म में होंगे या फिर ट्रू फॉल्स की फॉर्म में होंगे, यू डू नॉट नो।
नहीं, EMQ एंड ट्रू एंड फॉल्स अब आप लोगों के पेपर से कंप्लीटली निकल चुके हैं।
हाँ, वो
AKP के लिए भी जो है ना उन्होंने, AKP के लिए भी जो हमने एक और मेरे पास थी, वो मैं आपके साथ शेयर करूंगी, वेबसाइट से ही मैं आपको शेयर करूंगी। उसमें यही मेंशन है कि अब आप लोगों के कोई EMQs नहीं है, कोई ट्रू एंड फॉल्स नहीं है।
डॉक्टर आयशा, अभी जो इन्होंने रिकॉल्स किए हैं सितंबर और मई वाला, शायद उसमें थे कि कुछ एक्सटेंडेड मैचिंग थे सितंबर में या मई
अक्टूबर से
में।
चेंज हुआ है सबके लिए। जो आप लोगों का जो चेंज
हेलो
आया ना, पॉप टास्क एकेपी सबका चेंज जो है ना वो अक्टूबर से आया है। ये जो न्यू चेंज आया
हेलो
है ना,
मेरी
यस
मेरी
यस यस,
आवाज आ रही है?
जी जी
मैं
डॉक्टर
इस दफा
सनाउल्लाह बोले।
AKP में अपेयर हुआ था, तो इसमें 60 ही क्वेश्चन है बस, बाकी एक वो नहीं है एक्सटेंडेड। ये सिंगल बेस्ट क्वेश्चन थे बस, 60 और 60। बिल्कुल आप ठीक कह रही हैं, वो नहीं है, वो रिकॉल्स पास्ट वाले हैं, ये वाले नहीं हैं।
ओके
ठीक है।
ठीक है। सो अब वेरी
जी
वेरी क्लियर कर लें, अक्टूबर से पैटर्न चेंज हुआ हुआ है सबका, फॉप टास्क एकेपी सबका चेंज हुआ हुआ है। तो टोटल क्वेश्चन जो है वो आपके, अब जो आपके सिंगल बेस्ट है ना उसमें पिक्चर्स भी हैं, और डॉक्टर इकरा सारी पिक्चर्स के साथ आपके पास डेफिनेटली सिनेरियो दिया होगा। कोई ऐसा नहीं होगा कि यू विल गेट द क्वेश्चन और यू विल गेट द पिक्चर विदाउट अ सिनेरियो, दिस इज नॉट पॉसिबल।
ओके।
सिनेरियो वुड बी देयर with that, okay? Okay, अब यही they are telling you how you going to proceed the question, especially with images. ये आप लोगों के लिए separate thing थी, एक just second.
सिनेरियो मैडम ऐसा नहीं है, ऐसे सपोज उन्होंने एक्सरे दिया है ना, जैसे क्लेविकल का फ्रैक्चर था, तो उन्होंने ये सिनेरियो नहीं दिया हुआ था, उसमें सिनेरियो नहीं था, जैसे उसमें लिखा हुआ था सर्च दी एबनॉर्मेलिटी लाइक, ऐसे था सिंपल सिंपल यही बात थी कि एक्सरे दिया हुआ है और
ठीक है
आइडेंटिफाई करे। तो क्लेविकल का
ठीक है,
फ्रैक्चर था, उसमें सिनेरियो नहीं था, मतलब ऐसा जरूरी नहीं है
ठीक
कि सिनेरियो हो और उसमें।
ठीक हो गया,
जी
सही है, ठीक है। तो ये भी हो सकता है कि you do not get the scenario, but if you have a scenario, then how you going to approach these type of questions? This is a separate, yani you do not have any pictures in your FOP and task exam, okay? But now you going to have a picture, and how you going to approach it? So see, first of all, what they tell you, if they provide any question stem, if they provide any question stem, first read that question stem before jumping into the image, okay? This is the practical way which they explain us how you going to approach. Once you have read the question stem, then you go to the picture, then look at the picture, and in the last you will going to see the answer options, okay? For most of the thing, when you read the scenario, you will see the picture, the thing will click in your mind, then you will search that thing in the question answer stem, okay? So the approach should be like this: first read the question, then see the picture, and then in the last you will see your answer stems, okay? Okay, so what type of images and photograph material you required for your exam? So you can see over here photographs which used in the exam. It could be clinical. Mostly they are from the clinical. They are, just a second. Okay, so the photographs would be like, you can see over here, they can ask you radiograph. So radiology would be there in your exam. The exam can ask you about any investigations as well, illustration of any investigations. They can ask you about any pathological material, any disease, for example, picture of any SAR, like for example, Burkitt lymphoma, or any pathological picture could be there. Or what you find in, other than that, candidates are asked to, what they're going to basically ask after giving a picture. First, they can ask you identify the abnormality. As Dr. Sanaullah told us that they will provide a X-ray with the fracture, and they will going to ask either identification of that abnormality, or they can ask you to provide a diagnosis with the picture, or they also ask you to recommend investigation for that, or treatment, or combination of these. Okay, so that would be expected. So for any picture will be there, they can ask you to identify the abnormality, what diagnosis is there, what further investigation would be there. Yes, pictures would be clear in the exam. You do not have any confusion regarding the picture. Am I right, Dr. Sanaullah? You did attempt the exam, so you can tell us the experience, the recent experience with us. Yes, regarding pictures. Was the pictures were very clear, or you have any problem to identify them? Are you there, Doctor? I think he's not there. But the pictures, Dr. Ikra, which when I gave the exam, I do not have any problem. They gave a very clear pictures. They do not, in that picture, you do not find any ambiguity. Okay, so they are very clear. Don't worried about that. Okay, what type of data interpretations they will going to expect you for the exam? So you can see over here what type of data interpretations for specifically you will going to focus for your exam. You can see over here they can ask you simple investigation as well. So you should know about how to going to interpret CBC. They can ask about that as well. Then the most specifically they will ask about the ECG. You should know about it. EEG, some specific EEG basically they want you to know it, not you do. They do not want to master in the EEG, but specific exam related EEGs, like in the TOACS exam we prepared for, our exam for FCPS. You should know about the audiogram, the cardiac catheterization, CBC reports, and further that these are the basics one which basically ask in the exam for investigations. Okay, how you're going to proceed and which books you want to know for that. Okay, so first of all, you can see this is the recent one which we are using. Previously we use a different schedule for AKP, but I told you how you're going to proceed with that. First of all, the very important book, if you do not have a time, so basically the study period for this exam, ideally it should be 4 months. It should be 4 to 6 months. If not 6 months, ideally 4 months. Okay, because you have lot to cover. You can see over here you have to read these textbook 1, survival guide 2, AKP cases 3, new format 4, and of course the guidelines is separate. So total you have 4 books to read. AKP master course, survival guide, AKP cases, new format. These are the separate, or you can see the different books from the FOP and TAS. Along with that, you have to cover the extra investigation related material like the ECG, echocardiography, the different pictures, especially the dermatology pictures and all that. You have to cover that as well. So that's why it requires at least 4 month duration. And along with that, definitely you have to solve the guide, you have to solve the recalls, and with the recalls, whatever the guideline they are asking in the recalls, you should cover all those guidelines related to it. But we have this study schedule separately for AKP, and this study schedule will be shared in the group. I will share. And the good thing is that this study schedule is categorized on the system base. Like you can see, if you take the cardiology part first, so they categorize the questions which are present, the cases which are present in the AKP book. So you have to rate these cases. The new format, what is the new format? New format is a book which contain a clinical cases. Okay, so you have a case with it, and then you have a questions, and after that they will give you a small description regarding that case. Okay, so they have categorized these cases, the system wise. Cardiology may they have mentioned which cases are related to the cardiology, and they also mention the guidelines as well. Which guidelines you in AKP you need more guidelines as compared to the FOP. In FOP you need some guidelines, like for example for cardiology you just cover the when we were studying we just focused on the SVT part more. That is 1 to 2, or infective endocarditis prophylaxis. So we basically cover 2 or 3 guidelines. But for this you need a multiple. You see so many guidelines are required. This exam is extensively based on the clinical, so you need more guidelines. Okay, and these are the important books which you have to cover it. Okay, for AKP master course, this book, if you it's choice. Okay, it's a choice between survival and AKP master course. But if you see, the pages are very small. If you take the cardiology session, so 158 to 176 is just of almost 20-page chapter. But if you do not have a time to read from the AKP, just see the pictures, because pictures are very important. So just look at the pictures from the AKP book as well. Look at the pictures from the illustrated textbook of Paediatrics as well. So don't miss those pictures which are provided in their text. So the books which are provided by the MRCPCH, don't miss that pictures at least. So you have an idea if they come from that. So you quickly pick that picture. Okay. So because picture is a part which can come from anywhere. So you cannot predict it. But definitely the common things are common. So you should know the common pictures, common pathological conditions which can be recognized by the picture. You should know about it. So that is why the if you want to take the textbook as a textbook, take the survival guide. This is a very, very good book, and it is written, in a very simple way, and the things are very concise in it, very point to point. Like, for example, what are the important points related to the diagnosis of any disease, how going to investigate, what are the important investigation, what is the specific treatment related to it. So they just, you can say, summarize the disease in a one paragraph. So this is the beauty of that book. So I would suggest survival guide is a very, very good book. If you have a limited time, just do these three books. If you have very limited time, for as you have already covered that book, you do not need to give so much time. So the thing which you have to know for the theory, at least some theory before going, if you are planning for the January, so go for survival read first and AKP clinical cases and the new format. These three books are the top most important. 1, 2, and 3. If you do not have a time, cover these three books, new format, AKP cases, and survival guide, and take the pictures, just the picture part from the AKP master course, along with the illustrated textbook of pediatrics. From both, you will just see the pictures. Okay, is this clear? Any question regarding this?
डॉक्टर आयशा, ये इसमें कितने % रेडियोलॉजी में आ जाता है? हमने देखा अब कोई पास पेपर हम देख रहे थे, काफी सारे रेडियोग्राफ्स दिए हुए थे उन्होंने।
रेडियोग्राफ्स आते हैं, बिल्कुल रेडियोग्राफ्स। लास्ट टाइम भी जब एग्जाम हुआ था अक्टूबर से पहला वाला, तो 5-6 तो एक्सरेज ही थे, जो मैंने लोगों से सुने थे, तो यही बता रहे थे कि 5-6 के करीब जो है ना वो एक्सरेज थे। अब इस वाली डाइट के अंदर कितने आए हैं तो वो तो हम अभी नहीं, अभी रिकॉल्स आएंगे, देन ओनली वी कैन प्रिडिक्ट। बट रेडियोलॉजी पिक्चर्स इज अ वेरी इंपॉर्टेंट पार्ट ऑफ एग्जाम ना, तो अब उसको कवर करने के साथ कम से कम आपके पास अगर लिमिटेड टाइम हो तो सर्वाइवल गाइड बहुत जल्दी रीड हो जाती है। इट डज नॉट टेक लॉन्ग टाइम। एकेपी केसेस भी हर चैप्टर के यहाँ सेपरेटली मेंशन होंगे, आपने बस वो पढ़ लेने। और न्यू फॉर्मेट आपकी प्रैक्टिस है, वो कोई ज्यादा टाइम नहीं लेती। अगर इसके अंदर 1, 2, 3 ये एक पेज के 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 अगर ये 13, 14 भी केसेस है, इट मे टेक अराउंड 2 hours टू सॉल्व them. बट यू हैव टू गो थ्रू इट कि किस तरह से वो पूछे जा रहे हैं। गाइडलाइंस आप भले ना पढ़े अलग से ना, आप जब क्वेश्चन सॉल्व करेंगे, रिकॉल सॉल्व करेंगे ना, तब आप उसको उठाते जाएंगे, तो आपके दिमाग में वो चीजें याद होना शुरू होंगी। अलग से बैठ के पढ़ेंगे तो वो डेफिनेटली इट टेक्स टाइम। टाइम की अगर कंस्ट्रेन है तो फिर आपने उसको इस तरह टेलर करना है कि आपने ये इंपॉर्टेंट थ्योरी कवर कर लेनी है। ठीक है, अब ये बुक्स की पिक्चर है, ये बुक्स मैंने आपको ये सामने यहाँ पिक्चर्स शो कर दी कि कौन सी बुक्स जो है वो एकेपी। इसकी सॉफ्ट कॉपीज भी हमारे पास अवेलेबल है, वो हम आपको ड्राइव के अंदर शेयर कर देंगे। जिसको सॉफ्ट पिक्चर्स के लिए आप सॉफ्ट कॉपी यूज कर सकते हैं, बट फॉर रीड यू हैव टू बाय द बुक। पीडियाट्रिक रेडियोलॉजी फॉर MRCPCH, ये आपकी मेन रेडियोलॉजी की बुक है जो स्पेशली AKP में पढ़ी जाती है। एंड दिस इज अगेन अ वेरी वेरी गुड बुक। ये भी बुक जो है वो अंडरस्टैंडेबल है, इजीली अंडरस्टैंडेबल है, और इट कंटेन सो मैनी पिक्चर्स। इसमें भी बहुत सारी पिक्चर्स हैं। आप अगर, आई डोंट नो एग्जैक्टली द नंबर, बट सो मैनी एक्सरे, CT स्कैन। And what I used at my time, I read another book as well, which is named From the Basic Radiology. So I'm going to share that book as well. I cover 2 books for radiology just to, make my concepts clear. But you should spend time with this book as well. Pediatric radiology, clinical cases. People prefer to read only AKP. They do not read survival, but it's all up to you. The choice is up to you. But these are the 2 important textbooks which are in front of you. So that you can see the logo of the survival guide as well. Along with that, this red book on your right side, you can see this is your new format book. Okay, so the PDF, the hard copies of these books are easily available. If are not available, then definitely you can get a printout of it as well. Okay, so these are the important books. So if you have limited time, just take with these 4-5 books. So many books, people recommend it. If you have a time, you can go for it. For example, the book which I read for practice, these are basically, those books are not the theory books, they are just the question books. Like, for example, you will listen from different people, Abu Nazir, Abu Bashki. These are the different books. People used to do it, practice it. I also practice at my time. It's all up to you. If you have a time, you can go with it. If you do not have a time, definitely you just have to focus on these books. Sample papers and past recalls like the FOP and TAS, it is very important. These sample papers are on your website, so you can go through it along with the past recalls, as these are also very important. The duration of the study, I told you, at least if you do not have a very good experience, like some people are, they have a good experience in their like subject pediatrics, they have already cleared the FCPS in Part 2, so they are in practice as well, so they can take chance. But for those who are in the training, especially with the duties and everything, do not give this exam in hurry, because once you start the course, there are so many books, it takes time. So the good thing is give 4 to 6 months, but everybody is own. So these are the basic things which I want to share regarding the preparation. If you have any questions, then I'm here to answer all this. Any question? No questions? Ikra, do you have any question regarding the preparation?
नो डॉक्टर आयशा, लेकिन ऐसा कोर्स लेंथी है ना, यही आपने बताया, कंपेयर टू फॉप एंड टास ज्यादा टाइम लगेगा।
यस, टाइम है, ये ऐसा नहीं है कि आप बिल्कुल इसको जो है ना वो करके ले लो, क्योंकि देखो आप इस वक्त मनी अगर आप उसकी देखो ना, तो आप बहुत ज्यादा स्पेंड कर रहे हो, 800 एंड समथिंग पाउंड्स है, देखो। सो आपको इतना वो भी नहीं होना, आपके अपने उसके ऊपर है ना कि आपने कितना पहले उसको टाइम दिया। इट्स 900 पाउंड्स, it is expensive than your FOP and TAS. 775 is your FOP and TAS, and 895 is your for AKP. So that is why the sincere advice for those, especially जो main majority of the candidates हैं जो अभी ट्रेनिंग में है, वो 4 to 6 months से पहले रिस्क ना लें। बाकी देखिए आपके अपने ऊपर है, लेकिन जिनका क्लियर्ड एग्जाम, जिनकी प्रिपरेशन है अच्छी, तो फिर वो उठा सकते हैं। फिर उनको मैंने स्पेसिफिक बुक्स बता दी हैं, और जो 6 मंथ पढ़ना चाह रहे हो, उन्हें अगर और प्रैक्टिस बुक्स चाहिए तो वो भी हम प्रोवाइड कर देंगे, और वो बहुत सारे ग्रुप्स में ऑलरेडी अवेलेबल भी हैं, तो वो भी वो कोई ऐसा बिग इशू नहीं है मटेरियल का। दैट इज ऑल फॉर प्रैक्टिस, ठीक है। बट मेन मटेरियल जो स्टडी मटेरियल है वो यही है AKP का। अच्छा, अब हमारा क्या फोकस है? हमारा फोकस ये है कि जो प्लान कर रहे हैं 2 मंथ्स के लिए, तो कम से कम ये है कि उनको बेसिक सपोर्ट कर दी जाए, जो स्पेसिफिकली AKP से रिलेटेड जो थिंग्स हैं, जो कि AKP से रिलेटेड न्यू थिंग्स हैं, ठीक है। थ्योरी already we have covered in our batch as well, FOP and TAS as well, and those who are already give the FOP and TAS, majority of us gave AKP after FOP and TAS, so definitely they will have a background theory. What is different for AKP is the picture, is the ECGs. They want a practice related to it. So we can help you, we can provide you so many practice related to these pictures, ECGs, audiogram, so that you have a confidence for that. And we will going to discuss our recalls in our class. Along with the recalls, whatever the important guidelines we are facing regarding solving it, we will going to cover those guidelines. The important thing related to the guidelines, we will also tell you, or we will going to discuss it. Okay, so this is a 2 months, the 2 months are left. We will going to start from the 1st November, inshallah, the course, and we will do it only 3-day class. So 3-day class, 3 days is for yours, so you can study the theory part in 3 days, and remaining 3 days, the 3 days which we decided is Thursday, Friday, and Saturday for recalls discussion, for picture discussion, for all these photographic material. So that is our strategy for this 2-month crash course. Okay, inshallah. And this is our this is the contacts if you want to contact with us. So this is all, that is all from our side. So if you have any questions, you can ask it, and if you do not have, then I'm going to end this session. Okay, then if you have any questions, you can ask in the group as well. Thank you so much for everyone, and Allah Hafiz, and best of luck for your exam. Thank you.